Megan. Hi, Megan.
Hi, Carly.
All right, so why don't we just start by having you introduce yourself to the audience and tell them what you do here at the Tampa Bay Times and what you've been doing during the pandemic.
Sure. So actually became a health reporter a couple months into the pandemic, so I learned pretty quickly. But I basically mostly cover COVID right now. I've done a lot of work on hospital capacity, how hospitals are dealing with the influx of patients. I've also done some of our numbers, just regular number story, counting cases, counting deaths, that sort of thing. And right now, my entire world revolves around coronavirus vaccines. So, kind of become a vaccine nerd here in the last couple days and weeks.
Well, that's good for what we're doing because you're going to be able to answer some questions that people have had about the vaccine. So
Definitely.
let's just jump right in. Why get the vaccine? Broad question, but
Right. Sure. So simply put, vaccines, they basically train your body how to be immune to a disease or how to fight off a disease so that you are immune. So the more people who get vaccinated, the closer we get to that term herd immunity that I'm sure a lot of us have heard through the pandemic. That basically means that a high enough portion of the population is immune to the disease because they've either had it or they've had the vaccine. And health experts really recommend getting to herd immunity by protecting people from a virus, not by letting them get it. So really the vaccine is our kind of pathway toward that, to where we can start what everybody calls normal, kind of get back to that.
Gotcha. And today we had some recent breaking news about the Moderna vaccine. Can you just let our audience know what that was, since it happened so recently?
Definitely. So most of you probably know that one vaccine has already been approved that was developed by drug manufacturers Pfizer and BioNTech in conjunction with each other. But a second one was actually recommended by an FDA panel today. So that means that it'll go before or the FDA as a whole will either approve it or not. And it's expected to be approved. The panel recommended it 20-0 votes. It has a 94% protection rate compared to the Pfizer vaccine, which is 95. So it's still pretty close to that. I know that their studies are ongoing, the trials, but there's been about 30,000 people in that study, which is a little bit less than the Pfizer trials, but still a significant number for what we normally see in vaccine trials. I know that there weren't any severe reactions to the Moderna vaccine, but now, which is the one that the FDA panel approved today. But there were some of the people who participated in the trial did have rashes, itching, and some other things, but it was minimal across the board. I know that once it is approved, the United States has already paid for 6 million doses to be shipped out. So pretty similar to the Pfizer vaccine. As soon as that was approved, I think within 24 hours, there were vials on trucks going out to all parts of the country. And that's what officials have said we should expect with the Moderna vaccine as well.
Right. So just to clarify, the Moderna vaccine is still waiting on approval. It was just endorsed by the panel, correct?
That's right. There's sort of two steps. So the panel reviews it. They go through all of the scientific data, all of the evidence and the reports that these companies that are making the drugs, develop. And so then they look at those and make a recommendation to the FDA. And then the FDA, of course, has to give actual approval.
Gotcha. I'm already seeing some questions in the comments, but I promise, guys, we're going to get to a lot of stuff. So just hang tight. So my next question is, how much will it cost, and can I get it for free if I don't have insurance?
Sure. So I think that this is one of the biggest misconceptions when it comes to the coronavirus vaccines. They're meant to be free for everyone, regardless of insurance status. So even if you don't have insurance, that's not the case with some other vaccines. But I think, the pandemic sort of pushed government officials to realize we're going to have to really kind of pony up here. So the federal government has already paid for millions of doses of both of the leading vaccines, Moderna and Pfizer. And officials at all levels of government really have said that will continue to be a priority, and that they expect every American who wants a vaccine to be able to get one at no cost.
Gotcha. Well, that's good to hear.
Yeah, definitely.
Should you get a vaccine if you've already had the virus? We've been seeing this question a lot.
Yeah, that's a really good question. It's one that's in my inbox a couple times a day, at least. But yes, you should. That according to experts, according to the CDC, the FDA, all of those entities have said that if you have had the disease, you can get something called natural immunity. That's what you get when you get a disease and your body develops its own response. But the level of natural immunity that you get varies from person to person and varies disease to disease. So it's kind of a risky thing to say, oh, well, I had COVID, so I probably won't get it again. There's really no evidence to prove that. I know that there was some earlier on in the pandemic, that was kind of a rumor that was getting around. And while I think that that can happen in some cases, it's not, there's not strong enough evidence to say that that's the case in every person that's had COVID.
Right. Okay. So if you've had COVID, you should maybe, hopefully, probably get vaccinated still.
Right. Yes.
So a lot of people have also been asking and have concerns about, potential side effects and risks of getting the vaccine. Can you speak to that?
Sure. So the side effects so far in the vaccines or only one vaccine has been approved, but one is close, and the side effects on both of them have not been extreme. I know with Pfizer, there were, of course, we don't know the long-term effects because the vaccine has not been out long enough. But the short-term effects have been pretty minimal and pretty common when it comes to vaccines. Even the flu vaccine can give you some of these symptoms like fevers, chill, soreness at the injection site, fatigue. So things that you'll probably get over within a day or two. That's what experts are saying. I know I have some numbers here for you that I thought were interesting. The Pfizer's trials included 44,000 people so far. And of those 44,000 people, 84% had pain at the injection site. So that was the worst symptom, which, I mean, I have that with a flu shot. So I think that that's probably just common with if you have a needle going in your arm. And then 63% had fatigue, 50% had headaches, and then all the other symptoms, it was 38% or lower. So there really hasn't been anything super concerning. And local doctors here that I've interviewed said that if anyone does have a severe reaction, it would be a very rare event.
Mm-hmm. And what have those doctors said about whether or not the vaccine is safe and if it could give you a mild case of COVID-19?
Sure. So something that's interesting about the COVID-19 vaccines, the two that are leading, Pfizer and Moderna, they're using a new technology and what it's called the messenger RNA. So it's a type of vaccine that does not require injecting actual live virus into your body, like with the flu vaccine, which I'm sure a lot of us are familiar with. When that goes into your body, it's actually introducing some of the flu. And so then your body has to figure out a way to respond to that and fight against it. And that's how it teaches you to become immune to the flu. With this vaccine, it's very different in the way that it interacts with your body. It basically is a code of instructions, and it teaches your body how to teaches the cells in your body how to make that immune response, teaches your body or your immune system to activate when it sees these proteins that the vaccine puts inside of you. So it basically teaches your body something without putting you at risk of actually contracting the disease that you're trying to fight against, if that makes sense.
Yeah, I definitely think so. Is there some kind of metaphor that you could use to explain it kind of in the most basic way of what it does to your body? I know you were saying it gives your body instructions. Can you just repeat that a little bit?
Yeah, sure. So it's a little difficult for a metaphor maybe, but the way I picture it is it's kind of little soldiers going into your body and going into your cells and telling the cells, okay, listen, it's called a spike protein. So basically, here's the spike protein, here's what it looks like, and here's what you need to do when you see it. And so then your body, when it gets the first dose, because of course the two leading vaccines require 2 doses, when it gets the first dose, your body recognizes the spike protein and starts learning how to respond to it. Your immune system learns how to respond. And doctors say that it's really important to get the second dose of these vaccines because that's when your body, it's kind of like meeting a person for the first time. When you meet them the second time, you recognize their face, you know who they are, you get to know them a little bit better. And your response to them is different because you recognize it. So hopefully that makes a little bit more sense.
That definitely helps, yeah. That actually leads me to my next question was going to be what's in the vaccine. We've seen so much stuff on the internet about what's in the vaccine. Don't worry about what's in the vaccine,
Right.
But really what it comes down to it, do we know what's in it?
We do, actually. The FDA recently put out a list of ingredients. A lot of them are not very easy to pronounce, but I can kind of explain what they are. One you might remember from science class, lipids. That's just another word for fats. So the Moderna vaccine and Pfizer vaccine, they have different lipids in them, but they both contain that. And basically, that the fats in it stabilize the messenger RNA, that thing I talked about that goes in and gives the cells instructions. So that's kind of stabilizes that, make sure it gets to where it needs to go. There's sucrose, which is just a fancy word for sugar, and that also acts as a stabilizer. And then I'm gonna read off some of these ingredients to you all: potassium chloride, monobasic potassium phosphate, sodium chloride, and dibasic sodium phosphate dihydrate. That's all the ingredients. So there's only 6, I think. And all of those last things I read basically are used to maintain the pH balance of the vaccine. So that is a totally inclusive list of ingredients that the FDA put out a couple days ago on the Pfizer vaccine. So I would expect the same with the Moderna vaccine and whichever other ones come, after that.
So the vaccine doesn't contain the actual virus?
No, not at all. Nothing. There is no COVID-19 in these vaccines. And so that's why, a lot of the doctors I talk to, a lot of the experts, they're recommending to get this because they're saying there's no chance that you can get COVID. And I think that that's something that people are afraid of, is that they're going to get it and then maybe they get sick 2 days later and then they find out they have COVID. But I think, on the other side of that, people are a little anxious about getting the vaccine because it is a new type of vaccine. It's not something that we've had the chance to use before, this technology.
Right. And then going back to, choosing to get the vaccine, which a lot of, discourse has been happening about that.
Right.
What happens if you decide not to get it?
So basically, if you don't get the vaccine, you are simply just at more risk for getting COVID-19, and you're putting the people around you at more risk for getting COVID-19. And earlier, when we first hopped on, we talked about herd immunity, and really, according to experts and doctors, and really, if you just think about it, if we don't have a majority of the population getting vaccinated, it's going to be a lot harder for us to reach that herd immunity. It's going to be a lot harder for us to move past the coronavirus pandemic and try to get back to normal, where we're able to go out and do things and, work in our offices and do those types of things, because then there won't be enough people that have that immunity.
Gotcha. So on the other side of things, you decide you want the vaccine. How do you receive one? And particularly, what's the process in Florida and in Tampa Bay going to be like?
Sure. So that's the $1 million question right now. That's the question that my email, I probably have that question 100 times in my inbox right now. I wish that I could answer it. I wish that I could tell you and look at your situation and your age and your family and tell you exactly when all of you are going to get a vaccine, but we really don't know. I can tell you what we do know, though, is that the plan is to start with healthcare workers. So right now, hospitals are doling out these vaccines to frontline staff and kind of working their way, from people who are most at risk of contracting COVID-19 at work, and then kind of backing it out. And then at the same time, nursing homes, long-term care facilities, they're working on vaccinating residents and staff there. And then there's kind of some confusion. Florida hasn't released its final plan for vaccine distribution. It was due to the federal government on December 4th. So about 13 days ago, and Governor Ron DeSantis has yet to release it. So we're kind of operating in the dark. We do have a draft plan from October, and that leads us to believe that after healthcare workers, after people living in long-term care facilities, then we're going to turn to first responders like cops, firefighters, EMTs, that sort of thing, people who are really interacting with the public often. And then after that would come seniors who live independently, people with comorbidities or other, autoimmune disease, things that make them at higher risk for contracting COVID. They would come next. They're sort of the high risk general population group. And then after that, they would work their way down to people who are younger, people who are not as at risk, do not have those kind of underlying conditions that could make them, more susceptible to COVID.
Gotcha. And is there any kind of way that the state will notify people when they can get the vaccine? What's the best way to find out if you could get it and when?
Sure. So this is another one of those things where I don't have an exact answer. We really haven't gotten any direction from the state on that, about how just, regular everyday people just living, at home, not living in a facility or not in a hospital. We really haven't gotten any any guidance. So I'm not sure. I will say in the draft plan, there was a suggestion that primary care physicians could possibly be reaching out to their patients. But at this time, we really don't know. The primary care physicians that we've interviewed, they basically say that they're getting calls all the time from their patients asking when they can get the vaccine. And they're having to tell them, we don't know. We're working on it. We're just waiting. So I think it's just sort of a, we have to wait and see situation, but it's coming.
Mm-hmm. Cool. Well, if you guys are just joining us, I'm here with Megan Reeves. She's our health and medicine reporter here at the Times, and we're talking about the coronavirus vaccine. So if you've just joined, hang around. We still have a lot to talk about. So moving on back to kind of like the mechanics of the vaccine, how long will it last, and will you need a booster later on?
That's a good question. Or questions. The first one, we don't know. I've asked a couple doctors that here in town. I've done a lot of research on it, but it's just not known yet how long you'll have protection after getting the vaccine. Of course, they've been in trials, but this is, it's finally being spread across the country, so we just don't have enough data to know that. But as far as a booster, the first two, the Pfizer vaccine, the Moderna vaccine, both of those require 2 doses. Some have called those booster shots. Some have tried to stay away from that word because it kind of implies that it might be optional. I know Governor Ron DeSantis has suggested that possibly 1 dose might be enough for some Floridians, but that has not been approved by the FDA. The FDA's approval and recommendation was contingent on 2 doses per patient. So after you get a first dose, it's going to give you about 50% protection from the coronavirus, but after your second dose, you're going to have 95%. So it's a significant difference. Some doctors that I've talked to have really aggressively recommended against just 1 dose, especially in light of the governor's comments. It's just not, one of them, the way that they put it to me was that it would be a waste, frankly, because, there's such a limited amount of vaccines, and how they're rolling out in Florida, that we really need to allocate those vaccines to people that are going to follow through and get that second shot.
Right. And with like the concern of whether or not people will actually follow through, is there any kind of plan for how to keep track of who has 1 dose, who has 2 doses, and making sure that people will come back?
Right. So again, a lot of this is unknown and just kind of speculation on my part or the part of other reporters, because we're still waiting on the state to release that plan. But based on what we're seeing from the federal government, and what I'm hearing from local experts here, they're telling me that the federal government is keeping a national database, basically, and states will use that to report who gets a vaccine, when they get the vaccine. Each vial, it has 5 doses in it. So that would mean 5 people's names will go next to a barcode that was on that vial. And it will say, this vial was given out on this date to these people, and here's their contact information. And so then when it comes time for their second dose, they will be contacted. It's unclear on who will do that, if it will be whatever facility they got the dose at the first time, if it will be their primary care physician, if it will be the government, the Department of Health. It's not clear.
Gotcha. We did get a question in the comments about different strains of the virus, and if there are different strains, and if the vaccine protects against multiple strains.
So COVID-19 is a strain of the coronavirus itself. So these vaccines are specifically for COVID-19.
Gotcha. Okay. So we also have some more questions. Okay. 1 second. So who decides, we have a question that someone asked us on Instagram about who decides which frontline workers get the vaccine and when.
Yeah, that's a good question. Especially right now, because all of the focus is really on healthcare workers right now. And I think it really varies hospital to hospital. I think generally people are focusing on people, staff members who have the most contact with COVID patients, right? So the people who are at the highest risk of contracting COVID-19 at work. So I think that's kind of the general framework, probably nationwide, and throughout the state. I know that that's something that the governor has recommended. But there's not really more specific instructions than that until you get at the hospital level, because it really depends on how that hospital operates, where their COVID patients are, that sort of thing. So I think it could depend.
Mm-hmm. And kind of along like that same line, why has some Tampa Bay area hospitals been included in the rollout and others haven't been?
Sure. So the federal government decided, this is what I've been told by Governor Ron DeSantis and some other experts here. The federal government decided that they would do a pilot program in Florida, basically pick 5 hospitals in the state that would, have the capability to store these vaccines. They have to be stored at extremely low temperatures. There needs to be space. They need to have the capability to distribute it. So they picked 5 hospitals in our area. That's Tampa General, which is the region's largest hospital. And it's a hospital that's partnered with the University of South Florida and has that capability to really get out into the community and spread the vaccine. So the way it was described to me is that when the federal government looked at the state, they tried to think of places that are most populated. So the 5 hospitals that were chosen, 2 are in South Florida around Miami, 1 is in Tampa, of course, and others in Jacksonville. And the last is in Orlando. So, you're looking at places where there's many people, and you're also looking at hospitals that are, have that high level of capability. So I think that the goal there was really to give the state a chance to have sort of a pilot program or like a dry run, seeing how it would go with just kind of a small group of people. And then that would kind of guide the decision making and the distribution going forward.
And there's also a pilot program for nursing homes, right?
That's right.
Can we talk about that a little?
Yeah, sure. So the state so far has been allocated, or at first was allocated about 80,000 vaccines for nursing homes. 60,000 of those were given to Walgreens and CVS pharmacies. They partnered to go into nursing homes, go into long-term care facilities and distribute these vaccines. And of course, Walgreens and CVS have the capability to store, because they are pharmacies. So I think that was a partnership that was pretty streamlined. And then the other 20,000, those are where that pilot program is coming from. And the governor picked Pinellas County here in Tampa Bay and Broward County and said, we're going to send 20,000, I think it was 21,000 Pfizer vaccines, split them between the 2 counties, and that'll be a pilot program for the Department of Health and the Florida National Guard. Basically, they created these strike teams. So it's 2 people from the National Guard, 2 people from the Department of Health, and they're going into these nursing homes and making sure that the vaccines are distributed.
Okay. So, going off of like nursing home and the elderly, I know it's been also a concern like for people like the elderly who are more fragile, or for people with pre-existing conditions or pregnant women,
Right.
Is the vaccine safe for them?
Sure. So when I've posed this question to many different experts, their opinions have varied a little bit, honestly. Some have said absolutely not. Pregnant women should not get this. There have been no studies on pregnant women with these vaccines. Another expert told me, talk to your doctor. Maybe you have considerations in your life where you are coming into you have a high chance of contracting COVID. And so you would rather take that chance than, you would rather get the vaccine, and take the chance that it might not be, the best for you, then I don't know, that doesn't really make sense, but you get to weigh your options basically. So I would say that that's probably the best answer I can give you is talk to your doctor. But I do know that some experts have said, well, first I'll say the FDA and the CDC, there have been no recommendations against any of those groups, compromised, people with underlying conditions, seniors who are significantly older, pregnant women. There have been no recommendations against any of those populations getting the vaccines. And that has been credited to this new technology, right? Because it's not a vaccine that's introducing a virus into your body. So you having those conditions wouldn't put you at a higher risk in theory. But again, I want to go back to always ask your doctor because they know your situation. They know your particular medical conditions.
Great. We did have a question that was related to this. Someone asked, what are the chances I will have a bad allergic reaction to the vaccine? And they mentioned someone in Alaska that had a reaction.
Sure. So again, I think it's hard to answer that question, in terms of chances. I can't really give you a percentage, but I would say talk to your doctor. Look at the ingredients list before you take a vaccine. I know that there have been some, pretty bad allergic reactions in a small percentage of people. But of course, if that's something that you're worried about, definitely look at the ingredients, talk to your doctor, go to your doctor ready with the other things that you're allergic to and just try to find a solution.
Gotcha. Well, there you go, user. Thank you for your comment and your question. Please, guys, please comment and put your questions in. I will try to get you answers. So, similarly, we didn't talk about age restrictions or like what the virus means or the vaccine means for children.
Sure. So as we know, children are less at risk of contracting COVID, but they certainly can. And that's a big consideration when you're thinking about something like school, you know, where you have hundreds or thousands of people on a campus. But right now there are not vaccines for children. The vaccines that have been approved are for people 18 and older, because those are the only people that the vaccine has been, you know, were in trials. Those are the only people who have actually taken it. So I will say, though, that Moderna and Pfizer are both working on vaccines for people 12 to 17. So I don't know how quickly that will happen, but it's something that drug manufacturers are working toward. And another note there, just kind of on the same line of thinking about school, talking with experts, they've basically told me, you know, we don't expect a lot of private companies to mandate these vaccines, but it could happen. But one did tell me, an expert from USF, Jay Wolfson, he's a public health expert, public policy, health policy expert. But he told me that he does expect schools to eventually require this vaccine once it's not under emergency use authorization, once it's, you know, actually regularly approved and has licensure.
Gotcha. So going back to like how we know that the virus is like safe for use, can you talk a little bit more about the trials that you've mentioned and how they have tested the vaccine?
Sure. So you know, that's obviously a concern. That the timeline, I think, is the biggest concern when it comes to the vaccine. I see it all the time, just in comments. I get emails all the time. You know, how can we know that this is safe when it was developed so quickly? You know, that the evidence that we have is all that we can look to, right? And we know that at least with Pfizer, and now we're learning more about Moderna, but we know that there haven't been many instances of severe side effects. We know that the side effects that have happened are pretty minimal, like I mentioned earlier, things like fever, chills, aches, and they're only lasting a couple days. And I will say too, I asked experts about that. You know, is this typical? They said it's typical of most vaccines because that's how your body reacts. When you get a vaccine, your immune system is being activated. So it's going to cause your body to have kind of weird feelings, but that's normal. That means that the vaccine is working. As far as the trials, a couple other things I can say are that what I've heard from experts is that even though this was much faster, many more people in a shorter amount of time participated in the trials. So it you know, more than your every year flu vaccine or something like that. You had tens of thousands of people participating, and so that gave them a bigger, you know, group to study. At the same time, something else I've been hearing is that the reason that this was able to happen so quickly is because of years and years of research on those messenger RNA vaccines. So this is something that's been studied for a really long time, and the pandemic kind of made the trigger get pulled on it, if that makes sense. And then at the same time, you also had countries, scientists and researchers from countries all over the world, you know, battling the same issue, right? So everyone sort of came together. You know, that's happened in our own community. When you look at local hospitals, their kind of competition has stopped. They're really collaborating in a way that we haven't seen. And I think that same thing happened in the medicine field, you know, and in the production of these vaccines. I think there was a lot of money. There was a lot of just effort and knowledge all put behind the same thing. And so I guess personally, I would say that makes me feel confident.
Mm-hmm. So, you know, COVID-19 like vaccine new, but messenger like RNA technology not necessarily as new. Is that kind of what you're saying?
Yeah, so it's new in the sense that we've never had a vaccine approved and rolled out in this way. That's a messenger RNA vaccine. But the technology has been studied for a really long time, and it's something that scientists have been working towards. So it's new to us, but it's not new to the people who are developing these drugs.
Gotcha. So we're wrapping up a little bit here, but I still have a couple more questions.
Sure.
Let's go. I have one question in our little question box. Oh, just kidding. We already covered that one. So back to some of the questions we've gotten over the past week. Will Floridians be forced to be vaccinated?
That's a great question. That's another big concern that I've heard. The answer is no. No one in the state of Florida will be forced to have this vaccine, according to Governor Ron DeSantis. That has been repeated by him several times throughout the past couple weeks, even earlier in the pandemic before vaccines were on the scene. I will say, though, going back to what I was saying earlier, private companies, private companies could already require this vaccine, even under emergency use, but the government could, or governmental entities like a city government or a county government, they could actually require employees to get the vaccine once it's approved, regularly approved and licensed, not under emergency use.
Gotcha. Sorry, we do actually have a question that just popped up.
Okay.
And this user wants to know, how will we know that the vaccine is working in communities lower rates? So I think like maybe underprivileged communities that have been, more highly affected by the virus.
Okay, I'm sorry. I was reading that question. I'm wondering if we can get some clarification, because I was reading that question as, how will we know when the vaccine is actually working? Will there be lower rates of infection? Is that?
Oh, actually, you might.
I think that
that's also a good question. Let's answer that
right.
one first.
Okay. All right. Great. So yes, the answer is yes, there will be lower rates. I don't know how quickly we're going to see that, but I will say that on tampabay.com, our data journalists are constantly scraping the state sites for information and building that into graphs that make it really easy to understand how the rate of infection, the rate of hospitalizations, the rate of death is changing. And you can search it by your location, your own county or address. And then at the same time, I'm in regular contact with many experts at USF, but one of them specifically is really focused on this data and really focused on these rates. And he's asked me that, as vaccines roll out, that I would keep in contact with him so that I can update our readers just on how the vaccines, what the vaccine's impact is in our community.
Gotcha. So the best way to know if the vaccine is working is to, follow our coverage, follow Megan's coverage, and always go to tampabay.com/coronavirus for all that coverage. Our commenter said both interpretations are fair. So I guess my next question is, have you heard anything from state officials about particularly rolling out the virus and focusing it in, communities that have been more hit by the virus?
Yes. Well, yes and no. I'm going to go back to what I was talking about earlier about the state's plan. We do have a draft from October, but that's the most recent thing we have. And even in that report, there's pretty minimal information about how that's going to happen. It kind of plainly says, we are going to focus on communities that have been harder hit. We are going to focus on communities of color. We are going to focus on communities, the people living in poverty. And there's really no explanation of what that's going to look like. So we're kind of still waiting. We do have a health equity reporter, Margot Snipe, and I know that she's working on telling stories about that. So I would say definitely follow her work.
Great. Okay, so we're just gonna wrap it up a little bit. But I did have some questions about, are there any differences that we really need to know about the Pfizer, BioNTech vaccine and the Moderna vaccine? Are there any big things that are different between them?
Sure. So not that I'm aware of. I mean, of course, they are different drugs. They do have different ingredients, but their ingredients are pretty similar. Like I mentioned earlier, in the Pfizer vaccine, we know that there's lipids, we know there's sugar, we know, some of those other things that are used for stabilization and pH level. There are very similar things in the Moderna vaccine, but I know the lipids are different, things that I don't think are going to matter to the everyday person unless you do have some of those allergies we've talked about. But for the most part, they seem pretty similar. Unlike other vaccines, like Johnson & Johnson is in the process of is in trials with its vaccine, which is expected early next year in January or February to be approved. That one is a traditional vaccine. It's not an mRNA vaccine like we've talked about with Moderna and Pfizer. So they're similar in that sense. Maybe a scientist could tell you how they're different, but I think to the average person, they're about the same.
Gotcha. That was going to be my next question, was if there are any more vaccines on the horizon. So you mentioned the Johnson & Johnson. Any other ones?
I would say, there definitely are other ones. I think Pfizer is working on a second one. I think I saw a headline of that today, but I can't say for sure. Sorry.
No problem.
But Johnson and Johnson seems to be the third one we're going to see approved. I know that Governor Ron DeSantis has said he expects that in February, either late January, early February. But he said that when that comes online, that will be the time when we can really start vaccinating Floridians on a mass scale.
Gotcha. Speaking of Governor DeSantis, someone in the comments is asking if he has halted any incoming vaccine shipments. I know there was some news today about that. Could you speak to that at all?
Sure. So on Monday and on Tuesday at two different press events where vaccines were being delivered for the first time in Florida, Governor Ron DeSantis suggested, or really didn't suggest, he just said straight up that Pfizer was having production issues, is what he called it, and that Florida would possibly not be getting shipments. I think it was as much as like 400,000 or 500,000 doses of the vaccine. And he both in both of those instances he blamed it on Pfizer, said that it was a production issue. So Pfizer put out a statement today. Our reporters were really looking for answers from Pfizer, and then they happened to put out a statement today basically refuting both of those things. They said, we do not have production issues. There are no delays in shipments. We have millions of vaccines sitting in warehouses waiting to be shipped out. We haven't gotten the direction to do that. And they were kind of talking more generally. They didn't talk about Florida specifically, and our reporters weren't able to get in touch with them, but with Pfizer. But basically, they said that the governor was wrong. So now there's a lot of questions about if these vaccines aren't coming in, these vaccines that were promised, where are they and why are they not here?
Right. Sounds like a developing story. So please
Definitely.
follow that, you guys. Hopefully we will get some answers on that front. And thank you for that question. We have one more, and it says, is this the only disease that has multiple options for different types of vaccines?
That's a good question. It's kind of funny because that's my sister asking that question. So she's just totally embarrassing me on this Instagram Live. No, but I actually don't know. That's a really good question. That's something that I'll look into.
Great. Well, you can always follow up with your sister on that. But if anybody else is looking for answers, you can find Megan's email on our website, and you can ask her that as well. And then someone else is asking, are there enough vaccines for the total population?
That's a complicated question. That's the goal, right? That's the United States has said we're going to make sure that this happens. But obviously they're still being produced. They're still in trials. We still have ones that have not been approved. And I think we don't really know how many we're going to need either. That's another thing. We're seeing some polls that says half of the population doesn't want the vaccine. So of course that would make us need fewer. Experts say that minds could change over the next couple months, after healthcare workers are vaccinated and others in our community are vaccinated. If there's more safety data, more people getting the vaccine and being fine with the vaccine, more people could change their mind and have the willingness to get it.
Right. Cool. Well, thank you guys so much for your questions. One of the last ones I have was just, when I get the vaccine, should I still wear a mask? Should I social distance, or can I resume my normal life?
So I asked this question to experts recently, and they told me that we really should keep precautions in place until we do reach herd immunity, what I talked about earlier. And again, a reminder, if you don't know, herd immunity is basically when enough of the population has been vaccinated that the virus isn't as big of a threat anymore. So I think the guidance really here is just keep doing what you've been doing. Unfortunately, we don't know enough about the vaccine. Like I said earlier, we don't know how long it gives you protection. So you could get the vaccine and then a couple months later be doing, whatever, and then get COVID or, give COVID to someone else. We don't know how this is going to work. A quote I have actually from one of these experts, he said, if you've been good enough this year to wear a mask and do social distancing all this time, just continue to do it until we get this under control. There's so much virus out there. It doesn't make sense to take the chance. So I think that pretty much sums up the answer to that question.
Yeah, I think that's a perfect quote right there.
Mm-hmm.
So the last question I have for you, I like to, ask this to most of the reporters that I have online, on live, but there's a lot of misinformation out there, especially when it comes to coronavirus and the vaccine.
Definitely.
And do you have any tips for readers on how to avoid seeing something online that's not true and how to consult, sources that are reliable?
Yeah, definitely. So of course I'm going to say go to tampabay.com for your news on the coronavirus. Our coverage has been extremely robust this year. I think it's been something like 2,500 coronavirus stories we've had so far, and we're not slowing down, I can tell you. So I would just say make sure you're going to reliable news sources like the Tampa Bay Times or other, newspapers to get your information. If you do see something that seems kind of weird, probably Google it and try to see if there's any other news outlets covering it. And you can honestly just email me if you see something and you're not sure, or you think, you have a question that you haven't seen answered somewhere else, or you've seen an answer and you don't think it's right. I hope that you'll email me. It's just mreeves@tampabay.com. You can find me just on our website. And I would love to hear from you. I would love to hear your situation and try to answer your questions.
Great. Well, I think that's a great way to end this. Do you have any, last things, last tips, last takeaways that readers should have?
Yeah, one more
the
thing.
vaccine?
It's another plug, sorry. But one of the stories we have on our website right now is just a Q&A on coronavirus vaccine. So it's kind of like this Instagram Live, but preserved forever for you on our website. So if you just go to our website, tampabay.com/coronavirus, you can find it right at the top. It says vaccines Q&A. And if you go there, I'm going to be updating that almost every day with new answers that I'm getting from health officials from the CDC, the FDA. So just make sure you keep tabs.